I want to tell you about this poll that we've done at WebMD, where 27% of respondents said they would not get a COVID vaccine in the first 3 months.
Yeah.
Let me see how someone else does. Dr. Coyne Beasley, let me see how your response is.
Yes,
So
exactly.
how does that help if we're trying to get people to be vaccinated, have a sense of herd immunity? That's not going to be good enough, is
Right.
it?
Right. So no, to achieve herd immunity with the COVID vaccine, we need upwards of 60 to 75%, and actually really more than that to get herd immunity. So we really have got to work really hard in understanding people's hesitancy. One thing you've already alluded to is that we won't have long-term safety data as we do with most vaccines. And so that will be, part of the challenge. And so hopefully what we'll be able to demonstrate and see is that we'll vaccinate perhaps some of the people who are at greatest risk first. I want to make sure that we talk about the fact that you mentioned flu vaccine, and that's going to be really, really important because as we know, the COVID-19 actually impacts impacts the respiratory system probably the most intense, or what we understand the most about it. It'll be important for people to get their flu vaccine because you don't already want a compromised respiratory system. So while flu vaccine has been really, the uptake has been less than what we would desire, we really need to work hard to make sure that flu vaccine uptake is great as a way to actually prevent, deaths that can come from getting COVID disease among people who aren't vaccinated.